Sweating. It's a phenomenon that we can all relate to. Sweating is an important bodily response to an increase in core temperature, but what happens to performance when we sweat and experience losses in body water greater than a few percent? This is common for some athletes who train in warm environments and lose about several liters of sweat during training and competition. Some of you may have felt the symptoms of dehydration, which is defined as a loss of body water greater than 3% or a loss of total body mass greater than 2% after exercise. Some symptoms include tiredness, decreased alertness, decreased cognitive function, headaches, and even a loss of 1 liter of sweat will increase the sense of fatigue. Some elite athletes will have sweat losses amounting to 10 to 12 liters, and if this body water isn't replaced, serious outcomes can result. So what happens when athletes are dehydrated? In one study, 8 male endurance-trained athletes were dehydrated to different degrees and asked to cycle at moderate intensity for 30 minutes. So let's see what the researchers found. First of all, they showed that skin blood flow increased as body temperature increased in both the euhydrated and dehydrated subjects, but there was less of an increase in the dehydrated subjects. In the 3 and 4% dehydration groups, plasma volume dropped by about 3 to 5%, and plasma osmolality increased significantly as well, which is typical. The researchers also measured catecholamines and found that the stress on the body was higher in dehydrated states, with significant increases in epinephrine and norepinephrine. So what impact did this all have on the cardiovascular system? The researchers found that as dehydration increased, cardiac output decreased, stroke volume decreased, systolic blood pressure decreased, but heart rate increased. And when looking at muscle blood flow, this dropped with increasing degrees of dehydration. And most importantly, perhaps, as dehydration increased, the rate of perceived exertion increased, meaning that exercise was perceived as harder when athletes were dehydrated. So what does all this mean? Well, heart rate was elevated due to epinephrine and norepinephrine, and probably due to the increase in core temperature. The reduced cardiac output, stroke volume, and blood pressure is known as cardiac drift, which was likely due to a loss in plasma volume and a loss in ventricle filling or reduced ventricle filling. And we also saw an increase in skin blood flow, meaning that the body was attempting to regulate temperature through sweating, but there was a tug of war going on between the blood going to the skin for thermoregulation and the blood going to the muscles so that the muscles could continue to work during exercise. Clearly, as the study showed, a drop in systemic vascular conductance was found, which means that less blood was being delivered to the working muscles. So the big question now is what can be done about this?